So, as our president would say, hello to everybody. I don't know whether he's the president or the wolf. Anyway, thank you for taking part in this debate, in spite of the noise that I hear coming from your stomach. But we have to take it through to the end. Anyway, we're going to talk about cybersecurity. And just to prove you that cybersecurity is not a vain word, it's not an empty word, at the end of this debate, you will see that your telephones will be frozen for 5 minutes, and you will see displayed on your telephones a picture of Guy Valencien. And for those of you who leave beforehand, then you will always have that picture of Guy Valencien on your mobile phone. So anyway, Vincent Trilly, hello. So the healthcare sector is the one most impacted by cyber attacks. So that's an advantage and a drawback of digitalization. We've become techno-dependent. We'll start with the end, strangely enough. Not your end, of course. Please stay with us. But frankly, digital security, it's a utopia. Total security. I make the comparison with doping. The doping criminals are always one step ahead of us. Will we have total security? Well, it's increasingly difficult for them to find the mechanisms that they need, but they're still there. Yeah, they're still a step ahead. Cybersecurity, as you said, it's already linked to an increasingly wide digital service. 15 years ago, we didn't have any. We had the finance, we had human resources, but IT wasn't applied to healthcare, the healthcare sector. In hospitals today, all functions are digitalized. We've got labs, we've got data prescription software, we've got PACS, we've got REIS, we've got all kinds of acronyms in France. We've got huge amounts of systems for different specialities, cross-cutting medical files. We can communicate, and we communicate with the outside. We go out of the hospital to the area at large. So there's a large surface. There are many stakeholders, a lot of data circulating, and so cybersecurity problems when it comes to healthcare are going up. They're on the up and up, just like digitalization. Now, it's not, it's normal that we have these problems because we've got digital technology everywhere. So let's organize this in 3 parts. There's cyber danger, cyber hazards. Everybody's interested in cyber hazards, patients, doctors, etc. Healthcare structures, hospitals, clinics, institutions, insurance companies. But patients are also concerned because of what they have connected, smartphones, objects that are connected. It's things that are not always very secure. Now, what about healthcare professionals? Are they at risk a lot today? Well, healthcare professionals today, when you've got data that has a value on the black market, a medical file is between $30 and $200. It's not my medical file that might be interesting for somebody, depending on, because unless I was a VIP. The idea is to pick up millions and millions of data items so that processing algorithms can be applied to the data and trends can emerge for regions or whatever. This is economic intelligence. This is what we're seeing in industry. So it can be used for artificial intelligence. Yes, absolutely, of course. In a cyber attack, it's not the same thing. It can hurt, yes. Today, healthcare professionals, independent healthcare professionals have 2 problems. The fact that their IT is essential now, and this is what we're seeing today. We've got crypto locker viruses. They freeze your computer, and to unfreeze it, it takes 300, 400 users. And then there's this legal responsibility that healthcare professionals cannot shoulder. When we ask university hospitals today to organize and supervise what they do so that their data is secure, well, we're asking the same thing of independent healthcare professionals who are not IT specialists. When they have an antivirus software on their computer, that's already good, but it's all very borderline. It's a good thing, or it might not be a good thing, but that's not the point. IT will be on the cloud in the future for healthcare professionals. for independence, they need a PC, an internet connection. It's better for the data to be in the orange server, where it is more secure than on the individual's PC. Now, when I print the data, of course, anybody can copy that, falsify the documents, go and alter the documents. So, we're not secure yet. What about the blockchain? Can the blockchain help? Can help us with that problem? Yes, absolutely. Yes, absolutely. Everything's very vague. You've got a patient who takes an appointment with you. It has to be the right patient at the right time. You open the right medical file. You then make a prescription that goes to the pharmacy, and then it's administered. So it's very clearly an application that has to be supported by a blockchain that will provide traceability, security, costing, etc. So in France, and Dominique was saying this, I'm always surprised to see chief accountants, they've got a digital signature. And a digital signature, when I was talking about that in hospitals where I was, it's like when we sign so that the nurse can use it. No, a digital signature is a series of figures that cannot be encrypted. And if all people involved in the healthcare ecosystem, if they all had a digital signature, would have made progress. And that's not the case today. So we should be able to get all of that to change.
Can we talk about piracy of the patient's records? Yes, everything can be hacked into. These electronic medical records are in a place that's certified, and we should hope that there would be good practices to protect it. And what about telemedicine? Can it be hacked into? Yes, it's a video flow between 2 points. So either it's encrypted and secured because there are little boxes on either end that protect the secrecy, or it's fallible. And in that case, people could be listening in, just like the way they listen in to a network. They might hear what happens during these discussions between two practitioners or practitioner and the patient. Now let's talk about healthcare structures. We have a huge number of examples that show that we're not protected from cyber terrorism. Yes, healthcare structures, as I said, healthcare data interests people, so it can be stolen and sold, resold. There's a market for this. I navigate on the black market right now. There are 80 medical databases. The Hospital of Atlanta with 300,000 patients. In Farmington, Missouri, they were also hacked into, and there was a ransom for bitcoins. And in France, this happened. So that's the first point. The second point is that if the caregivers are increasingly dependent on IT, I had people working in the emergency ward 12 years ago who said, oh, we're emergency workers, the patients arrive, we intubate, and it's fine. But now you need to do a scan, an MRI rapidly. If all of your equipment around the patient starts malfunctioning, it's going to be very difficult. So there's this notion of the fact that all of this equipment has to be ultra available. Security is not just viruses. It also means that your equipment has to operate. If at the Paris airport this afternoon in front of the screens, the guy in the air control tower sees somebody who's hacked into his system, everything will remain in the air. And the hospital is the same. It's much more dependent on digital. This is why there are these DPOs and RSSI, so the information system security managers who work on the hardware. And the DPO, the data protection officer, they're in charge of making sure that the legislation concerning the usage of the data is complied with inside of healthcare structures. Yes, these structures must declare any serious event, and there are about 478 incidents since 2016. Are we below reality here? Yes. In 2017, there were 1,318 declarations on the old platform. Now we're on 476 for 2019. But 99% of these security incidents declared by the hospitals today are viruses, just IT viruses, crypto viruses that will create a mess. But is that a small incident? Or, well, Montpellier, they had 600 workstations that were inaccessible, and the emergency ward was disorganized for about a week. Ramsey, these were central systems that were encrypted and could no longer distribute their information to the 130 clinics. This is what we call encryption, and you have to pay a ransom to get the key back. 100,000 euros. Some people pay. Some people pay. Maybe you've heard this summer the American story. There was a city in Florida. It was $100,000. They paid for it. They got their data back, and Baltimore didn't want to pay. And the feedback was that it cost them $18 million. So what is extraordinary, to finish the story, is that the citizens of Baltimore are criticizing the mayor for not having paid the ransom and said, with your mistake, this cost 17 or 18 million. So do you find these cyber criminals sometimes? Yes. It's not complicated, but it's a planetary dimension, and you can understand that even if we know that the attack comes from China, you won't send 3 policemen from Chamonix to China. And so Louis de Funès traveling to Shanghai, that would be a bit comical. Well, what about connected objects? The users are in contact with these connected objects and these smartphones. Yes, so it's all very well. An insulin-dependent person who had to take all these shots every day, and now they have a connected insulin pump that calculates everything. It's a great improvement. Neurostimulators, all of these connected objects are fantastic, and they're going in the right direction, and yet they all have breaches. Luckily, there are some ethical hackers who've detected these security breaches, and they actually publish them. And the companies hire these ethical hackers. So we pay some of these players to detect these breaches. There's an Australian 4 years ago who sent 830 things into a pacemaker, and I think the pacemaker manufacturers had to rework their security after this. But it's a race. As you said, we're racing ahead. A new technology is invented. It's then put into production. The hackers show that it has breaches, and then we correct it, and we make progress. What's a real problem is when you start to insert things in people's bodies. Yes. Or diagnosis. An Israeli team showed this summer how they could manipulate images to remove nodules or add nodules on MRI images before the interpretation of the cardiologist. So that created a real shock. So biomedical equipment in general doesn't have a very high level of security because they weren't necessarily designed for these purposes. So the ANSM in France will be working on this. So does that mean that the people in healthcare are not trained enough? Is there a lack of human vigilance, a human problem? Well, the human problem is usually the main problem. That's usually the weak link. How do you catch an IT virus? 9 times out of 10, it's with emails that arrive when you're just asked to click. But the hackers are very smart. All of the employees of the Clinique Pasteur in Toulouse can potentially this afternoon receive an email from Dominique Pont, their director, telling them, please read my PDF attached. That's feasible. I can do it with my smartphone. So you trust it, you click, and then the virus arrives. Could AI maybe help? Artificial intelligence could help, and the cyber defense world in terms of security is evolving. We work no longer on knowledge databases. We tend to take a photo of the situation, a snapshot of a stable situation, and then artificial intelligence will inform us about all of the different deviations with respect to the stable situation. If you have something that's not going well, then you see with respect to our big data knowledge base, a certain problem will be occurring, and then there's a suggestion for improvement. So you're an optimist? Yes, you have to be an optimist. At any case, you have to be an optimist. Thank you very much.